Welcome, curious minds, to a journey into one of history's most startling and peculiar medical mysteries, the phenomenon of exploding teeth. Imagine the shock, the sheer disbelief if a tooth within your own mouth were to spontaneously shatter, or, as some accounts claim, explode. While it sounds like something out of a macabre fable, this unsettling concept has, at various points in history, been reported, debated, and even documented. Tonight, we delve into the annals of dental history and folklore, exploring the whispers and shouts surrounding spontaneous dental maxillary destruction. We'll examine the early reports, the nascent scientific theories, and how our understanding of this bizarre affliction has evolved, or perhaps dissolved over time. Join us as we uncover the truth, or lack thereof, behind the teeth that went boom. Our story begins not in a horror movie, but in the serious medical literature of centuries past. While the specific phrase exploding teeth might feel modern, descriptions of teeth spontaneously shattering or causing intense, sudden pain akin to an explosion date back at least to the 17th century. European medical texts occasionally contained accounts that baffled physicians. However, one of the most frequently cited and thoroughly documented early instances comes from 1817. A physician named Louis R. de Lepec, in his Observations and Cases on the Teeth and Mouth, described a patient experiencing an acute, violent dental rupture. This wasn't just a toothache, it was an abrupt, catastrophic event, leaving doctors scrambling for explanations. These early reports painted a picture of a truly terrifying and perplexing condition. Faced with such bizarre occurrences, early medical practitioners and scientists grappled for explanations. The theories proposed were as varied as they were imaginative. One prominent idea revolved around the buildup of gases within the tooth, perhaps from decay or a chemical reaction, leading to immense internal pressure that would eventually cause an explosion. Another intriguing, albeit less scientific, theory blamed electrical discharges or imbalances within the mouth, a precursor to later ideas about galvanic currents. And as was common in earlier eras when scientific understanding was limited, some explanations ventured into the realm of the supernatural, attributing these dental disasters to curses, malevolent spirits, or divine punishment. These early theories, though often debunked by modern science, highlight humanity's struggle to rationalize the inexplicable. The 19th century, a period of rapid scientific and industrial advancement, also saw an intriguing rise in reported cases of dental explosions. This era was characterized by significant developments in dental care, including the widespread use of new filling materials like amalgam. Some theories began to link these materials to the exploding teeth phenomenon. It was speculated that different metals and fillings, or even interactions between filling materials and oral fluids, could create a galvanic current, generating gases or pressure that led to the tooth's demise. While these specific material-based theories have largely been discredited, the 19th century undeniably offered fertile ground for documenting these strange dental events, partly due to increased medical record-keeping and a burgeoning interest in oral health. As the 20th century dawned and dental science progressed, reports of truly exploding teeth began to dwindle, eventually disappearing almost entirely from credible medical literature. Why the sudden cessation? Modern dentistry offers more plausible explanations for what might have been perceived as an explosion. Intense dental pain, often misdiagnosed in earlier eras, can be caused by severe infections, fractured roots, or extreme nerve inflammation, leading to a sensation of internal pressure or rupture. Furthermore, improvements in dental materials and hygiene likely reduce the factors that might have contributed to such dramatic events. The consensus among contemporary dental professionals is that spontaneous dental maxillary destruction, in the explosive sense, is not a recognized medical condition, and historical accounts are likely due to misinterpretations of symptoms or less sophisticated diagnostic tools. While the widespread phenomenon of exploding teeth has largely been debunked, the occasional oddity still captures attention. Even in modern times, there are extremely rare instances where a tooth might fragment suddenly, often due to significant internal decay, microfractures, or trauma not immediately apparent. These are not explosions in the historical, dramatic sense, but rather extreme forms of dental breakdown. Some researchers still ponder whether specific, unique physiological conditions or combinations of unusual factors could, in theory, create enough pressure to cause a rapid, forceful fracture. These cases are exceedingly rare, emphasizing that while the grand, mysterious, exploding teeth narrative has faded, the complexity of dental health always leaves room for the unexpected, albeit typically non-explosive, event. Despite its scientific debunking, the idea of exploding teeth holds a fascinating place in our cultural imagination and dental lore. It speaks to a deep-seated human fear of the body turning against itself in unexpected, violent ways. Stories of such incidents, whether historical exaggerations or genuine mysteries, contributed to the mystique of the human body and the often painful experience of dental ailments before modern medicine. It's a reminder of a time when medical phenomena were often interpreted through a lens of fear, superstition, and limited understanding. Like other strange medical curiosities from history, the tale of exploding teeth serves as a compelling narrative, a cautionary tale, and a testament to the ever-evolving nature of medical knowledge and human perception. So, as we conclude our exploration into the captivating and slightly unsettling world of exploding teeth, what remains? We've journeyed from vague 17th century whispers to documented 19th century accounts, through speculative theories of gas and electricity, and finally to modern scientific dismissal. The story of spontaneous dental maxillary destruction is a microcosm of how humanity grapples with the unknown. It highlights the blend of early medical observation, the limitations of past scientific tools, and the enduring power of a truly bizarre phenomenon to capture the human imagination. It reminds us that even the most fantastic historical tales often have roots in real, albeit misinterpreted, human experiences, offering a unique window into the history of medicine and our persistent quest for understanding.